This government meeting is brought to you by Eastworks and our local cable subscribers.
Valley tobacco control program to kick us off. Is Meredith or Donna here?
Hi, Madam Chair. Meredith O'Leary here from the Pioneer Valley Tobacco Coalition. I am looking to see if Donna Bowman is in attendance yet, as she was the tobacco control officer who conducted the youth compliance check, and I don't see her on the list yet.
Oh, I see. Okay. So then we'll just continue on with the regular.
If you don't mind, yeah, until
absolutely.
she attends.
I thought you guys were on here. My problem. My bad. All right then. So I make a motion to go back to our agenda order.
I need to make the motion, right? Okay.
Sure.
I'll make a motion to go back to our original agenda order.
I second that. Amy, yes.
Beth, yes.
All right. Beth, I had no concerns with the minutes from June. Anything on your side?
No, looked good.
Okay.
I'll make a motion to accept the meeting minutes from our last Board of Health meeting in June.
I second that motion. Amy, yes.
Beth, yes.
All right. And we will now move to the health agent update. Dennis, welcome to the Board of Health meeting. Where are you?
I'm not sure he could hear us, but he was having troubles being able to talk to us. I don't know why. We went over it at the office, but
I think that
I've got it if you have questions.
I went over it at the office, but
No, I think you guys have been doing a good job. At least I'm not sure if Beth is on them since we're all BC'd. Oh, again, I'm getting feedback.
Temporary food inspections have been going great thanks to Northampton. Chris can go over those with you when she does hers. She's been doing the nurse side, so if there's questions about the camps, she can go over that. The tobacco, we do have some housing issues, and I've got the septic. Amy, do you know anything about the septic when we have a property on Lead Mine Road in Easthampton that is part of a parcel that's actually in Southampton? There's no water connection or ability to connect to Easthampton on that side. They have a well. They want to reactivate the well. And Dennis thought the board needed to give an authorization. He approved the plan that was submitted. He thinks that's good, but he said I should ask you about approving on your end.
Unless there's any variances needed, I don't think we need to. He's the agent of the board. He can approve it on our behalf.
Okay.
If Dennis finds out any information that is different than that, and we need to have a last minute meeting so we can get them approval so they can go ahead and do the work they need on their well, just let me know. I'll let them know.
Okay. I don't know that much about septic, but I do know that he said the distances were where they were supposed to be. Everybody did the investigating for the city sewer, city water, and it's not available. And so I'll make sure I discuss it with him. And as long as it falls within guidelines, you guys are good with it.
We're good with that.
Okay.
That sounds great.
Yeah.
And then the housing.
I saw those.
Yeah. 4 Hoyoke Street. There's an issue with who legally owns the house. Dennis is going back and forth. The issue with the oxygen tanks that were in there, the fire came in on it and said that they were in compliance. There was no issues. There were people smoking in the house, but the way it was stored was fine.
Great.
So, that's still active and going through, but all right. And then the other part of it was the tobacco of his health agent or, okay.
He had to, yes, okay, the ones that we already know about. Great. Meredith, has Donna called in?
I don't see her.
Okay.
No, I'm
Then,
sorry, she's having issues.
okay.
Okay.
Is there any issues that we can help her with?
She's asking what the meeting code is.
Oh, is she on a phone? Oh, I don't know. Phone or on her computer?
I think she's calling in.
There's a pin, Meredith. You want the pin?
Sure.
Okay. It says the pin is 582 780 098 pound. Do you want the dial in number as well that she
I
needs
gave it
call?
to her.
Okay.
See if that works.
All right. So we'll give Donna a few minutes to join in. And so Beth, we want to make a motion to go out of order and take the mayor's report next.
Sure, I'll make a motion to change the order on the agenda and do the mayor's update next.
All right. I will second that. Amy, yes.
Beth, yes.
All right, Lindsay, you're up.
Good evening, everyone. So a few updates here. And Beth, I apologize because I think I forgot to BCC you on a few emails. So glad to be here tonight to help fill everyone in. We have decided, the mayor has decided to post the health director position at this time while we wait to hear from local communities on possible collaboration opportunities, just so that we can have essentially some backup in case we're unable to come to agreement with any of the local communities that we've been talking to. So by posting this position, we're able to filter through some applications and see how we can best support the department in case the need comes through. Additionally, we found out this week that we did not receive grant funding for the grant application that Hunter and Allison had filed for his position. So right now we'll be looking at Healthy Youth Coalition ending sometime in October. So Hunter and I sat down this week and talked about what's next for that position. The mayor and I think, you know, Amy, we've had these conversations too. We firmly believe in harm reduction and prevention. So what I asked Hunter to do is really write down a narrative and a scope of services that he would like to provide, not just under youth, but under the community as a whole, to see if there's any way we can help support that moving forward through the health department as well. So that's about all we have for updates right now, is that we didn't get the grant and we're still looking to come to a shared service agreement with some of our local communities. So happy to answer any questions or concerns.
Have we had any applicants?
No.
That's the state of public health right now in Massachusetts.
It is.
Are we pursuing any other community? I know the existing conversations are with the city of Easthampton. Are we talking to any other communities?
So we've talked to Northampton and Holyoke, and that's, I think, the only conversations we've had so far. And I think we'd probably like to hold there until we can have some more fine-tuned conversations. I know we were waiting with Northampton as they, you know, went through the trenches of their budget season, and we were closing ours too. So with the new fiscal year just starting this past week, I think we might be in better positions to revisit these conversations.
Yeah, that's good. I mean, I know that finding qualified health directors right now is like one of the most difficult positions to fill. especially with the state's new workforce standards. So I'd be curious to see if we get some applicants that
Yeah. And it's
could help
difficult
us.
because I think, we have this long-term vision that, it has our standards and requirements of inspectional services, but then we're also branching out into harm reduction and prevention. Things like our tapestry, we just funded tapestry with $30,000, Craig's Doors with $30,000. So we've been, investing into this a lot. So to find a director who has the adaptability to go both directions of inspectional services and human services is vital.
Okay. All right. Well, thank you for that update. Beth, I don't know if you have any questions on that.
No, thanks for the update.
Board member,
Sorry.
the applicants for board members, any updates?
Oh, yeah. So we had a few applications come in for board members, and we have put forward a recommendation for Stephen Coughlin to the Board of Health. He seems eager. He stopped by our offices and gave a couple rings and emails. So he is in the pipeline through the city council appointment process. So what will happen is he gets on the city council agenda, that gets recommended to appointment committee meets with him, reviews, then sends it back to council for a final vote. So it's about a 45-day process. So I would hope to see a new member on the board in August if they vote to approve.
And what's their background?
I don't have the application, so yeah.
He's a nurse.
Jackie.
I spoke with him. He's a nurse. He works for a pharmaceutical company here in Easthampton, over near the post office. They work with the components for vaccines and such. Their company had a lot to do with the COVID vaccines. And he's a nurse. I don't know exactly other than that.
And I would also just encourage board members, any members of the health department, any members of the public who are interested in hearing more about the applicant to attend his appointment committee meeting, where you're able to ask questions and listen in on what the appointment committee asks and discusses, because any type of weighing in holds value.
Do we know when that is?
I could check with the city clerk. She heads all the meetings. Okay. Yeah,
I'm sure it'll be on the website
posted under
too.
the agenda
Yes.
center. But if I see something or hear something, I can shoot it your way.
Thanks.
Welcome.
All right. Well, thank you. Meredith, has Donna arrived?
Yeah, Donna's here.
All right. We have the crew for a hearing. All right. So, Beth, you want to make a motion to open the hearing?
Sure. I'll make a motion to pause the Board of Health meeting and open a hearing for Pride with the Tobacco Coalition.
I will second that. Amy, yes?
Beth, yes.
All right. So now, if we could pass it over to our colleagues at the Pioneer Valley Tobacco Coalition to kick us off.
Hi there, everyone. Again, I'm Meredith O'Leary. I am the City of Northampton Health Commissioner, but today I am representing the Pioneer Valley Tobacco Coalition as its coordinator. And here with me today is Donna Bowman, who is a tobacco control officer for PVMCB as well. Donna was the compliance officer who did the youth compliance check on May 19th and is willing to give testimony if the Board of Health would like to hear it.
Okay, thank you. And it looks like we have someone here from Pride today.
James.
I am.
Hi, James.
Afternoon.
Good afternoon.
How are you?
Good. So you requested a hearing based on the findings of the compliance check?
Correct. It was more with respect to the potential penalty. We don't have any for efficiency purposes, and I appreciate everyone being here, but we don't have any questions with respect to the actual allegations
Okay. And so
for what it's worth.
what is the specific question on the fine?
I think there was a fine, but on the citation it indicated or cease and desist that it was also for I think it was a Valley Farms, and I don't know if it was a typo, but the cease and desist indicated not just Pride, but it also had Happy Valley, I think it was called. I apologize, I'm looking at it. Was it Valley Farms and the front
Valley
part, and so I
Farms.
didn't know if there was going to be a corrective cease and desist order with respect to that part, just to clarify, or I think it may have just been a clerical or Scribner's error. And then the second inquiry is whether or not there'd be an actual suspension. I think highlighted in the first part, it was checked off: first violation, state fine $1,000, local fine $100. But then additionally, there was a highlighted part with respect to, again, just being ordered to suspend all sales for 3 consecutive business days. And that was starting back on, it would have been July 1st, but I believe that was held in abeyance pending this hearing. So I think it's just more with respect to any potential suspension
Great.
of the permit based on the alleged
Perfect.
violation.
Well, thank you. I'm sorry for the clerical error. I'm not sure where it came from, but it was a clerical error because clearly only Pride's name should have been mentioned. So if Donna or Meredith could clarify for us what the fining structure is for the violation on Pride, that would be helpful. And we can certainly, James, get you out a new letter with the correct details. Meredith, you're on mute. It looks like you might be talking.
4 years later, and I still do that every once in a while. So I'm happy to do so. So this is a violation of the state law, and per section 105-665-045, the fine for selling to a minor for the first offense, which Pride is $1,000. And then in the section of 105-665-040, section D, there's also you have to suspend the permit for a period of between 1 and 30 days for the first offense. And it's up to the Board of Health to pick that suspension period if they have not codified that in their local regulation already, which Easthampton has not codified a finite amount as of yet. So you, as the Board of Health, get to determine, and it looks like whoever sent out the violation notice picked 3 days, the amount of time again between that period.
Okay. Would love to talk to you guys about codifying that, so this doesn't, when this comes up again in the future, we just have a set fine structure. And so that's a whole separate conversation. But I think, James, for your issue today, we will go with the 3 days that was in your letter, just to keep things clear and consistent. So we will get you out a new letter that is specifically for Pride, that lists the $1,000 fine and the 3-day suspension with a date for that to begin.
All right. I'm not sure. Again, you know it much more than I do, better than I do, but I thought if there wasn't a regulation, I went online, and what I can pull up for the Easthampton regulations currently are from 2018. And so I'm just not sure without there being an additional regulation, whether or not that fine would be consistent with the CMR. Again, I'm aware of what it says and how it says, but I read it, it says, shall be as enacted, adopted, or promulgated in a rule, regulation, or other measure by the appropriate and legally designated health authority of the city. And so I don't believe that that's occurred yet. And so based on that, I'm not sure if we would be subject to a suspension.
So the state supersedes your local. The local can't be less strict than the state, so it supersedes it automatically, whether or not the local Board of Health adopted the new regulation or not.
So it's a state law that your permit is being suspended by. We can't supersede that part. We can make our own local regulations that specifically state, but what you're being fined under is the state law, right, Meredith? That's what you're saying.
What was the last?
That it's the state law. It's state.
It's the state law. So yes, a sale to a minor, someone under 21 years of age, a violation of, the penalty is an automatic $1,000 fine per state law, and then a suspension period between 1 and 30 days per state law. The only latitude that the Board of Health has at this moment in time is to choose the amount of days. But otherwise, they have to impose. They are the enforcement officers of that state law, so they have to impose the fine and a suspension period.
And I think Brian, who is the one that wrote the letter, I think he put in the 3 days because when Valley Farms had their first violation, I think it was March, April, the board had determined 3 days for that particular offense for a suspension. So I think he went on, the first one was 3 days for that, so he copied it for this one.
I appreciate
I
it.
think
It's your
that's where
interpretation that a suspension is required. You said 1 to 30 days. Was that accurate? That's your interpretation of it? That it can't be held in abeyance or suspended or anything?
Can you repeat that last sentence? I'm sorry.
Yeah, my question is whether or not you have the ability and the authority, and again, obviously at your discretion, but whether the ability and authority to hold any suspension in abeyance for a year or have it paused or suspended. No, other regulations allow that. I'm not sure.
The tobacco code doesn't specify. It just says the fine, a suspension of 1 to 30 days.
I think, again, I'm not trying to be difficult. I think it says shall be up to, but I'm not sure if it couldn't be 0, but I deferred it.
If it starts at 1, it can't be 0. It says
It
1
doesn't
to
say,
30 days. It doesn't say 0 to 30 days.
I don't think it says 1, with all due respect, but yeah, if you want to provide me the additional information, I'm more than happy to look at it. Obviously, I'm not trying to be difficult. We don't contest the issues. Obviously, it's not something, I think we have a good track record. Obviously, everyone would agree to that. 1 sale to a minor is 1 sale too many, right? I mean, we're never gonna say anything to the contrary, but I think we're just more evaluating whether or not a suspension is required under law and appropriate. And I didn't see the regulation by the town, but again, I'm not going to question Health Director O'Leary's interpretation of it. I'm sure she's much more familiar with it than I am, and I'll just have to look into it a little bit further. So I appreciate your time again, and anything you can provide to me with the findings would be much appreciated.
Well, I think, I mean, it looks like Meredith might be looking at it, but as a board, historically, for first offenses, we vote for 3 days.
So I could read you the section if you'd like.
Sure.
Madam Chair, okay. Sale of tobacco product by retail establishment to a person younger than 21 years old shall result in the retail establishment being prohibited from selling tobacco products for up to 30 consecutive days or for a longer term as enacted, adopted, or promulgated in a rule, regulation, or other measure by the appropriate and legally designated health authority of the city, town, etc.
Okay.
So
Yeah.
again, the spirit, when it says up to 30 days, I don't think it meant 0 days. And it used the word shall, so, but everybody's interpretation can be different. The Massachusetts Association of Health Boards attorney Cheryl Sabara would support, it's 1 to 30 days.
Yeah, I think that it's pretty clear. There shall be a suspension. So 0 would mean no suspension. So it has to be at least 1 day per, what it says is what it sounds like to me.
So, Beth, I don't know if you want to make a motion, but I feel like staying consistent until we can promulgate our specific structure makes the most sense for us. And if 3 days is what we've done, I would be in favor of that.
I agree. I think the consistency is good for, from one establishment to the next. So I think we should look into codifying it moving forward. But just to clarify, we're looking to make a motion to on the final suspension or to, okay. So I will make a motion to fine Pride $1,000 plus $100 per state law plus $100 per local, and also suspend all tobacco sales for 3 days, starting on a date to be determined by the board.
Okay. I second that with an amendment.
Okay.
I think we should add a specific date. So probably by the time we get this letter out, James, August 1st.
Yeah. I
August
apologize.
1st would be a Thursday.
Thursday. Yeah. I'd prefer it to be a consecutive days during the week if possible, only because again, I defer to you, but if it's a Thursday, Friday, Saturday, then as you know, we have to remove everything from the store, all tobacco products while it's being suspended, and then having it somehow back into the store and starting to sell
On a
again
weekend.
on Sunday wouldn't be ideal, but
Okay, let's do Wednesday, Thursday, Friday. Oh no, so you're trying to have it back in. Okay, so
I just prefer not to be reinstated on a weekend if at all possible, based on the logistics and the requirements of us removing everything from obviously the sales floor and the.
great. So I amend Beth's motion to begin the suspension on July 30th.
I appreciate your.
All in favor?
No.
Amy, yes.
Yeah, Beth, yes.
And then, so Beth, you want to make a motion to close the hearing?
Yes, I will make a motion to close today's hearing with Pride and the Board of Health.
I'll second that.
Beth, yes.
Amy, yes. All right. Thanks, James.
I
And
appreciate
before
your.
of course, yeah. Before we let our folks from Pioneer Valley Tobacco go, how can we set up the next steps to codifying this for the next time?
Sure, I'd be happy to help. I think there's other amendments you could make to your current regulation. Again, these amendments are strategies that are evidence-based to help reduce youth initiation. A lot has come out since you've last updated your regulations. So if you would allow, what I'd like to do is take your current regulation and compare it to the new model regulations, and in some type of track change form, provide you with what I think would be a really good fit for the city of Easthampton. And then you would have your Board of Health meeting, have a discussion, I would attend, and then give, if you would want some revisions, I could make those for you, and then move forward in another meeting and hold a hearing to amend the regulation. And part of that would be codifying that suspension period for the first violation for sale to a minor.
Okay, I think that sounds great, and we'd appreciate your help to do that. I thought we had that done, but I guess we're behind. Thank you.
All right.
Thank you.
All right.
I'll work on that and get it to Jackie in the next 2 to 3 weeks. So you have it for your next Board of Health meeting.
Oh, that'd be perfect. Oh, I don't know if we have one in August. So if you want to take your time and aim for September Board of Health meeting, we should have our third
for no
member
other
then.
reason, Brian will be back at that point, so he can be in on that conversation with you all. I do have a question though, still in the tobacco part of the agenda. Valley Farms, they never reached out to us to have a hearing. That's fine. It's no big deal. They did pay the fine, but I have no idea if they actually went through with the suspension. I had emailed Meredith, you had emailed me questioning me about it. I had responded, but I haven't heard to see how long it was. This is out of my realm. Or if it's still, I'm not sure if they had 30 days or not.
I believe it was their second violation, if I remember
Yes.
correctly. Did Brian make a determination on the cease and desist for dates for the suspension?
Did Brian make a determination? I'm not sure. The letter that went out, Hang on a second. I had it somewhere.
Typically,
Okay.
we
the let-
recommend that you hold off until you know there's not an appeal made.
It's labored. August 18th.
I did,
ends.
guys, it's Donna. I did go by the store this week and there was tobacco in the store. I thought that a letter did go out and the suspension was supposed to be through the end of this week. So I'm not sure the suspension actually happened.
Right. I'm pretty sure I have the email, but I don't have the official letter. But I believe the date was supposed to be the 2nd of July. It was supposed to start, and if that's the case, they didn't then. And we only just got the check Monday because it went lost in the city because it was made out to the city of Easthampton, accurate, but it wasn't addressed to the Board of Health. And it went in various offices looking to see who owned it until it finally came down to our office. So I have no idea when it arrived in the office in the city.
Okay, so it sounds like either they weren't aware of the suspension period and are continuing to sell, or they were aware and they're egregious and selling anyways. So if that was the case, they'd be in violation.
They had to be aware of the date because the letter went out with the dollar amount. They had the correct dollar amount.
Donna, did you make a purchase when you went by?
Did not.
Did not.
But the suspension, I believe, is still through the weekend. So I can certainly go back and make a purchase.
It's up to you, board, what you would like us to do.
Yeah, I mean, if they have not served their suspension, they clearly got the letter. They sent in the check, but they didn't remove the tobacco products. And they didn't request a hearing or appeal the letter.
So what would making a purchase do? Just
Evidence that they're selling
Okay.
during their suspension period.
yeah, that's what I figured, but
Testimony would be enough, but we like to have
Yeah.
actual physical evidence as well.
yeah, I think we should do that. I mean, it sounds like they're ignoring the suspension, so
And so what happens, I mean, what would our next steps be if they have tobacco still on? I mean, either way, they have ignored their suspension.
So, right, I would have to review your current regulation to see. So I don't want to speak out of turn.
Okay, that's fair.
Yeah.
So Donna, you think you can get over there? I mean, we have your testimony that the tobacco was on the shelves. We'll try to get a sale also.
Yep, absolutely. Yep.
And then we'll send them another letter. Could your team draft that for us?
Sure.
Well, it would be helpful
I'd
to
be
have
more than happy to.
the proper language.
Yeah, and the other reason to make the actual purchase is because they could come and say, we just didn't remove them from their shelf. Sorry, we didn't know about that part. So to make a real determination if they're selling or not.
which would be hard to believe since this is their second violation and they've already had to remove all of their tobacco from their shelves once before, correct?
Right. And in fact, the sale they made was not from stock that was on the shelves. It was from stock that was in a box behind the shelf.
Yeah. Yeah.
Okay. Thank you for all of your help.
Certainly. You're welcome. All right. I will look into your regulation and I will email all of you with what I think the intent and interpretation is and how to proceed.
Okay.
And I'll make a point to get over and try and get a sale. And when I do, I will send you all an email with the details.
Okay.
Very good.
Thank you.
Thank you. Have a great night.
Bye.
You too. Bye.
You
Bye.
too. Okay. We will
Liz.
get back to our agenda. Liz, is Liz here? I thought she was off.
Excuse me.
Oh, go ahead.
Sorry to interrupt. This is Beth Tiffany. I'm a public speaker.
Oh,
Not
Beth,
at this time.
we had public comment at the beginning of the meeting. We called for public comment and asked if anyone.
Oh, we were having connectivity issues and apparently we missed that. I've been waiting.
Beth, I'm going to address the correction at the end of the meeting in the subject title, not things addressed before. But you won't be able to address the board until the next meeting, or like I said before, in an email.
Alrighty. Thank you. Did you have us on record as attending as guests or
Yes.
no?
Yes. Yes.
Alrighty. Thank you.
Okay.
What did they say for truth?
So I am here. I wanted to hear the update from the mayor's office about the director position and everything. My house has a bit of a summer flu going on, so I'll be brief. I know I sent my update. The two events that I wanted to highlight coming up, there's the Veterans Cookout at Nonotuck on July 21st. I'm on the board for that. And there's the overdose awareness vigil that's going to be Monday, August 26th at Millside Park. So those are two projects in the works. The other big and exciting thing, which is in my report, is that we are finally getting going with Tapestry being in town. I'm super excited about that. I met with their staff 2 weeks ago. They brought their mobile van to 50 Payson to show me what they are able to offer and just talk about what their staff can do. So tomorrow, they said they would be at Millside around 2 p.m. just to start meeting with people. They can do delivery of supplies. They can meet with people. They're going to start by setting up at Millside. It sounds like, once or twice a week, no more than like 5 or 6 hours just to see how things are going. But that is rolling out, which is super exciting because they've been helping our residents for a long time anyways. And it just eliminates one more barrier of people having to find a way to get to Northampton by bringing them to Easthampton. So I think that's going to be great. And they are also going to bring the mobile van and table at the overdose vigil as well. So that'll be really nice.
Excellent. Great work, Liz.
Yeah. So I think that's about it. Everything else is in my report. Jackie and Lindsay both have a bunch of resources from me while I'm out. So hopefully whatever people need is in good shape.
Okay.
All right.
That's great. Thanks, Liz.
Yeah.
Thanks, Liz.
Hope your family feels better.
Oh my gosh, thank you. It's like the daycare plague that never ends, I swear. It's constant. We'll get through it.
All right. Great. Dennis, I see you have your hand up.
I still don't know that he can talk. He's having troubles. Basically, he has concerns as being a temporary or interim health agent, being able to make decisions without running it through the board first, making sure that you are okay with what he's doing. Hoyoke Street was one of them, Lead Mine, the septic, Lead Mine Road, the septic was another.
Dennis is an agent of the board, just like any other agent of the board. He doesn't need to run things past us.
Okay.
We discussed this last meeting, didn't we? Like, yeah, he can act as an agent of a health agent of the board.
Okay. All right. I'll either see him or I'll talk to him tomorrow and just run it by him and make sure he's aware. I know he's been also going up to Lindsay and making sure some of it's political stuff, but just making sure everybody's aware who the players are.
He
So,
did send a
okay.
message in the chat saying he can hear us. We just can't hear him. So hopefully he
Yeah,
has heard all
we
of
did
this.
a run by this morning in the office. I showed him how the Google Meets worked and where the microphone. Oh, I hear that thing.
Yeah, thank you. Yeah, good.
But I'm not sure why it's not working on his home computer. Not sure. But
Okay.
okay.
Christine, you're up.
You're muted, Christine. You're muted.
Can't hear you.
Pressed the
There
wrong
you
button.
go.
There you go.
Sorry. So I pressed the wrong button and I ended up in settings. So anyways, yes. So the camps are going well. We have a couple more left. And then we will be done with those. Kevin from Williston has been very helpful getting us the information that we needed and hooked us up with the proper people and all that. So things have been going good. It's July, so foodborne and tick-borne illnesses are really ramping up. So Maven is keeping me pretty busy. We've had a bunch of dog bites, cat bites, and bats today. So it's been it's been a busy month, and it's things are going well. Do you have any questions about my report at all, or no? Okay. Well, thank you. That's all I have to say.
I was talking, but I was also on mute, and Google just let me know that I was talking. So if it sounded like I was just ignoring you, I apologize. No, thank you for the update, Christine. Appreciate it.
You're welcome.
And Hunter, I think that's you. First, Hunter, before you start, I want to sorry that you did not get your grant. I know that you and Liz worked very hard on that. So, and you've brought such great things to our community. We will be sad that you will not be with this in this capacity with us after the grant ends. When does the grant end? Was it a July 1st end date?
No, it's gonna end in October.
Okay.
So, and it's water under the bridge, there's other grant opportunities in the future, hopefully in whatever capacity that I'm serving in past October. That can be something I'm working on as well. It's just more funding opportunities, because that's something that that grant gave me a lot of experience and practice with, and I feel like getting some more experience with that would be fantastic. Anyways, hello. So Battle of the Bands, July 20th. So it's not this Saturday, but the Saturday after. I have yard signs throughout Easthampton now. I have a couple more to put out. Noon to 6. Originally, I had it from noon to 5, but some bands expressed concern with just making sure that we have enough time for everybody's acts to not get cut short. So I extended it to 6 p.m. Yeah, so that's that. I'm hoping to see people there. It's going to be a fun day. I'm looking, and Luthier's got back to me, Beth, as well, with equipment. So we're looking good there, which thank you so much for getting us in contact with them. So the second part here, let me share my screen. This was so last meeting we discussed me creating like a little slideshow to show, this was with the assumption that Valley Farms would be here for like an education piece. So I made this slideshow. Anyway, I'll just like quickly run through it. So, well, actually, I feel like everyone here knows these statistics. So it's just the statistics to do with cancer. Youth using flavored products over non-flavored products, how many deaths are attributable to nicotine, just everything. So now we have this though. So in the case that we have another violator that we want to show this to, or we want to do some other education piece to do with it, this is all set with sources in each of the little descriptions. So, in the case that we want to do that in the future.
Well, thank you for doing that. I did have an opportunity to see that, and it looks great, Hunter, and we will have that on. I think it should be anytime there's a tobacco hearing, they should have to sit through us or you reading that to them and just kind of re-educating them
We'll have to
on
film it.
why it is we're doing what we do, why 3-day suspensions versus no suspensions are critical to what it is we're
Yeah,
trying to accomplish.
especially when it comes to like flavored nicotine products that you shouldn't be selling either way due to state law, but just the fact that, you know, youths and everything are more likely to use those, and then all the trajectories and everything. Yeah.
Right.
And then last but not least, Kratom. So I talked to Cheryl Sabara. I hope I'm pronouncing that right. She said that she sent me the draft that Belchertown had, got from them for their Kratom regulation. She also mentioned that there's some other communities right now considering it, Needham being one of them. She didn't say the other ones, just other communities. So I'm just wondering with the board on what my next steps should be in terms of trying to get regulation within our city.
Yeah, I think she said Needham, who was one of the other communities that I suggested you talk to, was considering it, but we're waiting for more federal information to come through.
Mm-hmm.
So Beth, I don't know how you feel, but I like that idea of that Needham is taking about waiting for that federal data to come out to substantiate what it is we're doing.
Mm-hmm.
Hunter got a good model reg from Cheryl, which is the same that he pulled from Quabbin, it turns out, which so when we do have some more data to move on, we have the model reg to use.
Yeah, I agree with that. I think we should hold off.
Okay.
Awesome. Yeah, no, I think that's a good idea. Just especially because data should inform like everything we're doing as a Board of Health and agents of the Board of Health. So I've been looking forward for this data. So you know, I hope it doesn't confirm what I think I know about it, because that's going to be bad. But we'll see once it comes out. And
Perfect.
that's
Well, thank you.
yeah.
Thank you for keeping this on our radar.
Sounds good. And I'll keep my eye out for that regulation or the
data
information. Yeah.
Good. Yeah. And if you reach out to Tim and Needham, and like if he gets something or if he hears something, you could ask him just to forward it on to you in case you happen to miss it in the channels, because he travels kind of in a different channel.
Yeah, and I talked to him a couple months ago when I found out Needham was proposing it. So
perfect. Tim's a good guy. I like him a lot. So that's the official last item on our agenda. I did have one item, Beth. I'm wondering if we can transition our meetings to Tuesday nights and how that might work with your schedule.
It is a possibility. I will need to just check. So sometimes I have late days on Tuesdays, but there might be a predictable Tuesday where I can say I unlikely will be late. I just have to look at my complicated schedule.
We used to have our meetings, I think it was at 6 o'clock. I think we transitioned to 5:30 to make it easier for some people. Would a different time make it better for someone?
Sorry, go ahead, Amy.
I was just saying, not on my side. I had a change in parenting schedules that now I have my son on Wednesdays. So it just would, as you might be able to hear right now. So yeah, Tuesday, Mondays or Tuesday would be a better night for that, Beth. So if you wouldn't mind looking at some point.
Yeah, I just have to, it's a complicated schedule. I just have to look at what, if there's a specific Tuesday that might work. It won't be every Tuesday in the month, but there might be one Tuesday in the month that could work. So let me just get back to you on that. I can send an email to Jackie.
Yeah. Yeah. And if Mondays are better, Mondays could also work for me. I just thought Tuesdays would be a better night for folks than Mondays.
Yeah, Mondays are not great, so. But yeah, let me look and I'll email
Okay.
Jackie.
Sorry about that.
It's okay.
Yeah,
We have
Jackie.
other responsibilities.
So the people that were in the meeting that didn't have anything to do with the tobacco, they all had to do with the pond. Last month in the health agent update, Brian had made a comment, DPH, about the pond and the cyanobacteria, whatever that word is, at the pond. And he made a statement about what the DPH had said. And the Nashwanik Pond Steering Committee, I think is the title, took reference with it. And they said that there was a statement that he made that was incorrect. Beth, who is one of the people on the steering committee, came into the office. We had a back and forth. And I said, tell me what it is that's wrong. Send me an email. I can send it to the board and we can discuss it with the board, read it into the minutes so that their correction is read into the minutes. And they're just sticky about the fact that there signs up that says there's an advisory when there's not actually an active bloom in it. And I tried to explain to her that it's an advisory. It just means please be careful. And they would rather them not be there. And I said, that's DPH. And I think she reached out to Lindsay. I'm not 100% sure. But anyway, so her email came to me and said, thank you so much for the update on the meeting. Can you ask for a correction? And I told her, I said, I can't correct it, but we can read their comments into the minutes. So I'm reading it to the board. She said in the second bullet of the DPH advisory, it states on 6/4, the Nashwanik Pond Committee informed us that the Connecticut River Conservancy conducted a test on 5/31 and the pond tested negative for cyanobacteria. And then the next paragraph, it says, it may seem incidental, but we did not say it tested negative for cyanobacteria. The CRC, the Connecticut River Conservancy document that was sent to Brian stated the red line indicates the threshold for the bloom. Samples that test higher than that threshold ratio, greater than 1, are considered an inactive bloom. The Easthampton ponds underlined did not test positive for cyanobacteria blooms. Green surface matter that can be seen from the shore is confirmed to be a mix of duckweed, Wolffia, WOLFFIA, filamentous algae, and pollen, all of which are harmless to the environment and locals. So I read it to you and it's in the minutes. I will attach it to the minutes as well.
So basically what they're saying is they tested it. It didn't test negative. But
it tested under the threshold.
Under the threshold. But
yeah, and she said it's incidental, but she wanted it in the record.
But then there's this concern about the signs that are saying advisory signs that are up because it's suggesting that the pond is unsafe.
Right. And those signs, to be clear, because Brian and I had this discussion before he left, the signs are not at Nashwanik Pond. The signs are at Rubber Thread Ponds, which is right next to the parking lot at 50 Payson, the one that's bright green. Yeah, it's at that one. And it's basically just to say, please be careful. And the idea is that my understanding is when it's bright green, chances are all of the really bad stuff, not a science person here, so all that bad stuff that's supposed to be there is not at its highest number. It's when the green stuff starts to disappear that the bacteria comes out, and that's when it's the most harmful. So keep the signs up now to make people aware, is Brian and DPH's thinking. Not so much for the pond committee.
I don't know the science behind it, so I can't speak to the bright green, the dark green, and the thresholds. I know that we have a Department of Public Health for a reason. If they tell us the sign should be up, I'm inclined, unless there's scientific evidence that shows that what DPH is saying is wrong, and then we can have a conversation with DPH, to believe what DPH is telling us. If their concern is that the language used in Brian's report was not totally accurate and they want that read into record, it's been done.
Yeah.
Beth, any concerns with that?
Yeah, no, I agree. We as the Board of Health, we leave it there. And if she wants to take it up with DPH, and address it with them directly, she can, but it's their purview, and we made an error, and whatever, we corrected that, what Brian said. Or at least read that into the minutes. So I think that's as far as we need to go.
Okay.
All right.
And I did explain to her how the process went as far as public speak. She was aware of that. She had problems, but there were other people here and they didn't speak up.
Yeah. I always feel bad when there's concerns, but I always feel like keeping the schedule and not going back and forth. So I'm sorry that she didn't get a chance to speak, if that's what her intent was to do. All right, Beth, you want to close us out?
Well, do we have a meeting?
Are we meeting in August, or a lot of times we skip the August meeting?
Yeah. As of now, it's the second Wednesday, right?
Yes.
And I will be on vacation, so I won't be able to attend. So should we just, for simplicity?
How about to be determined, and then you guys can let me know when the September one will be, if it'll be on a Tuesday or a Wednesday.
Sounds good.
Yeah, because I'm on vacation the 3rd and 4th week, so I don't think we will. Yes.
Okay.
So she's the 2nd, I'm the 3rd, and part of the 4th. So I think September meeting TBD based on the correspondence that will come through Jackie.
Sounds good.
Okay.
Thank you,
now
everybody.
motion.
Hope everyone enjoys the rest of the.
I will make a I just didn't want you to hang up before we officially ended our meeting. I will make a motion to end today's Board of Health meeting exactly an hour after it started at 6:30 p.m.
All right, I second that. Amy, yes.
Beth, yes.
This government meeting is brought to you by Eastworks and our local cable subscribers.